Good afternoon, and thank you for joining us. My name is Dr. Roy Alcalay, and I'm a movement disorder specialist from Columbia University um, in New York. So, as you can imagine, being in New York, I have um, the unfortunate experience of working in an environment that has been hit hard with COVID-19. The one upside of this situation is that I have now significant experience with telemedicine, and I wanted to share this experience with you in this webcast. I wanted to talk today about telemedicine because it's become such an important part of care for people with Parkinson's in the time of COVID-19. So just a brief background about telemedicine is that telemedicine has been widely used and very important in providing care. In neurology, for example, it has a very important role for people with strokes when they come into institutions that don't have stroke doctors or stroke services. Stroke doctors can review the person with the symptoms online and decide whether they should get the stroke therapy and whether they should be transferred to a stroke center. In Parkinson's, it has been used mostly in research settings, but we can probably use telemedicine a little bit more. The two most important instances where I think telemedicine in general, even before COVID-19, could be extremely helpful is one when people live in an area without specialists around. So there are no movement disorder specialists in the town or the area where people live, or not even neurologists. Telemedicine can provide an opportunity to connect to a specialist. And the second opportunity where telemedicine can be extremely useful is when people have advanced Parkinson's disease and the commute to a hospital and the transportation can be very cumbersome and may make people think twice before getting into the doctor to get an appointment. And providing telemedicine in these instances can be extremely helpful, even when going to the hospital is something that one can do very easily. And then comes COVID-19 and changes everything. And now coming to the hospital is actually, in some places, extremely holds problems with it. It can be unsafe because one may get exposure to COVID-19 if you're going to a hospital in an area with high rates of COVID-19, not to mention the transportation may require breaking the social distancing. So in that setting, telemedicine has become widely useful. The one upside of the pandemic and the way we reacted to it is that regulations around telemedicine were extremely lax, making telemedicine much more useful. So first of all, for example, I work at Columbia University in New York. So a lot of my patients live in the state of New York, but some of them come from New Jersey, Connecticut, or they prefer to spend the winter or most of the year in Florida. And beforehand, because I was not licensed in these states, I was not able to provide telemedicine to people if they were physically at that moment in Connecticut, New Jersey, or Florida, or any other state. And now, because the regulations were changed, I'm allowed to see my patients wherever they are within the United States. On top of that, in order to make things easier, the regulators previously decided which telemedicine vehicles are appropriate and are HIPAA compliant. And the two that people usually use are often the hospital system. In the case of a lot of hospitals, it's Epic, but it can be other computer systems that offer videos. And another one that is considered HIPAA compliant, and we've been using it in research setting, was the system Zoom that everybody knows now. I think a couple of months ago, the knowledge of Zoom was limited to people that were using lots of conferences in their work life. The regulator is now allowing us, we try not to, but we're allowed to use other video infrastructures like Skype, like FaceTime, like WhatsApp videos, if we cannot do it by Zoom or by Epic, which are still, we're trying to be as compliant with HIPAA as possible considering the situation. So I think telemedicine actually offers a lot of great opportunity. It offers a lot of great opportunity in the times pre-COVID, and with COVID, it allows a lot of options. First of all, a lot of the doctors, like us, opened up our clinics because I would like to do everything I can to keep my patients at home and avoid going to urgent care or to the hospital where they can be exposed. That's why a lot of us opened our schedules to telemedicine visits, and in a way that may not be as expected, people with Parkinson's may have faster access to providers because so many providers have responded to COVID-19 by opening up telemedicine schedules. Telemedicine schedules can happen in the evening, can happen in the morning. They're not dependent on space in the hospital as opposed to regular visits. So the opportunities and the options are quite wide. Telemedicine has also two major limitations that are very obvious, that I'm just mentioning them, but you all know. One is that as a doctor, I can't examine, I cannot physically examine some of the things that I could do in a personal visit. For example, in Parkinson's, we always test the rigidity, where we take the arm or the limb and check to see the tone, and that's something that you cannot do on a televisit. We check postural reflexes by warning a person with Parkinson's we're going to pull them backwards and then pulling them backwards to see the recovery. And that's, again, something that I would not do in a telemedicine visit. In some instances, blood pressure and heart rate can be measured by the person doing telemedicine or a family member, but sometimes we cannot do that either. The other second limitation of telemedicine, that it's not as personal. We cannot shake hands, we cannot hug, and that's the advantage and disadvantage of telemedicine. On the other hand, you don't need to be concerned about your doctor's exposures and who else did they see that day, because you're not going to get COVID-19 from a telemedicine visit. Very unlikely. So this is outlining more or less the telemedicine pros and cons. I can say that preparing to this podcast, I am now more experienced than I was when we first scheduled it. I can tell you that doing telemedicine with people who are interested in getting it, you can see the people's environments. There's actually some components of it that are even more personal than I thought it would be. Family members can join in or out as much as they want, and that's still very much doable. And it makes people feel connected to their healthcare system, knowing that if there's a problem, they just talk to the doctor. So even though we're all affected by COVID-19, you can still get your care. There are a few things that I would recommend preparing before a visit to get ready. Just like a regular visit, even though you don't need to get dressed, you don't need to take a transportation to get to the doctor or look for parking, there are things that are exactly the same, and one needs to remember that because it'll be extremely helpful and make the visit more efficient. So first of all, like every other visit, come in with a medication list. So when you're asked which medications you take, you'll have those available. It's always useful to know what pharmacy you're using. And I strongly encourage, because of the social distancing, to take a look at your medicine cabinet before the telemedicine visit and see if you're short of any of the drugs. You really want to use that opportunity to make sure that you have as many drugs as possible based on your prescriptions, and ask your doctor if it's possible with your insurance to get as long of a supply to reduce the amount of time that you need to communicate with your own pharmacy. In addition, like any other visit, please make make a list of questions you want to ask the doctor before the visit. So then you have them all outlined for you, and you can ask them just like a regular clinic visit. Prepare a pen and pencil and a paper to write down the answers from the doctor. You can always ask for a follow-up note or a follow-up email, but you can also write down during the visit the recommendations that were made. So these are advice that are probably very good in every visit. People tend to not remember that a telemedicine visit is like a regular visit. So we need to know your medications. We need to know your pharmacy. We want to renew your medications, actually give you as much as we can to avoid frequent travels and phone calls to the pharmacy. And we want to answer all your questions, so prepare them as much as possible ahead of time. There are a few things that are unique to a telemedicine visit that you want to get prepared before a visit. You want to make sure that your internet is working, that your phone or the item that you're going to talk with is charged, so it doesn't get broken down during the middle of the conversation. If there's a way for you to do a communication check, if you're using a software that you can use with someone else rather than the doctor, like FaceTime, Skype, WhatsApp, or Zoom, you can try it with family members to see that all is working. If not, and you're waiting for the, for example, we use Epic in the system, it's called MyChart. You can just make sure that you're logging in, that you did not forget your password, and that all is set for the time of the visit. My experience is that when people come to their clinic visit and the doctor is a little late and they've seen them going back and forth in the hallway, they're okay with that. But for a telemedicine visit, if I'm 5 or 10 minutes late, just because I spent more time with the previous patient, people are concerned. They're like, is something wrong? So we want to be actually more punctual with telemedicine visit than we can than in regular visits. So in order to make sure that the time is used for the best interaction with the doctor, make sure that all the communication and device preparations are ready. We're Parkinson's doctors, so we're going to ask to examine you. So make sure that the space you chose for the televisit would be appropriate for that. It's best if you're seated rather than lying down if possible. And you want to do it in a place where when you're asked to do the exam, you will have the space to do that. Maybe someone that can hold the device while you're being examined, because some parts of the exam going to be requiring some manipulation of the device. Most of the televisit would be a conversation, so it will be very useful for the doctor to see your face. Ideally, if possible, also your arms to look for tremor or for your look at the rest of the body. But really, during the conversation part of the telemedicine, you want your face to be very well exposed. But expect that the doctor will try to do as much as they can like a regular visit. So we do the exam that we often call the Unified Parkinson's Disease Rating Scale, or the Movement Disorder Society version of it. And it requires asking you to do things with your hands. It requires to do things with your legs. And what we commonly ask is to see whether you can fold your arms and stand up with your arms folded. So just make sure that if this is asked, that the environment is set up for it, and that you'll have the space to do it. Also, we often like to examine gait. So think what hallway would be the best hallway to get tested in, where there's enough light that they can be seen and that it's not blocked by furniture or by pets or the laundry and so on. So expect to be asked to do some parts of the neurological exam, and it would be a lot about your face and your hands and legs the way the regular exam is, but also the additional parts of folding your arms and standing up and walking in as wide of a hallway as your social distancing environment allows you to have. I think that you will see, once you did a telemedicine visit, that you actually have a lot of attention from the doctor, and that this is actually a positive experience. We didn't query people who did telemedicine visits at Columbia yet. We'll probably do it in the future to see their impression from telemedicine. Because you're talking to one another via a device like that, there's usually much less interruptions than there are in clinic. Nobody comes in and asks to measure your blood pressure or heart rate. Nobody knocks on the door because they got the wrong room. So in some ways, the telemedicine visit can be more intimate. So one of the questions that people were asking is about visits that may be more complicated to do in telemedicine. The two types of visits that are absolutely much more complicated to do by telemedicine than in person are Botox injections and deep brain stimulation adjustments. Now, what I suggest is, if this is your case, is to communicate with your provider to see what is it that they recommend. In some areas that are slowly opening up, Botox injections can be made. In some areas, the doctor may have a consultation with you and see what medications can help you to bridge the time until it's safe again to go to the doctor and get Botox injections. With deep brain stimulation, there's lots more that can be done. the device can be interrogated, battery checks can be done, and with some guidance, the nurse practitioners and the doctors that monitor the deep brain stimulation can help. There are things that can't be helped remotely, and what I would recommend in this case is to start with a telemedicine visit. Describe your problem. The doctor or the provider can look and say, these are the things we can do, these are the things you can't do. And then after exhausting whatever can be done in telemedicine, to decide together about what to do with the next steps, which the next step may be that this is a case where there's no choice, but we need to prepare an in-person visit. Another question that people are asking is, who should be present in the telemedicine visit on both sides? So from the doctor's side, it is our responsibility, and we always have to say who's available, who's in the room, and who may hear you in addition to the doctor that you're talking to or the provider you're talking to. Some doctors work with fellows, and the visits can be three-way visits. Sometimes the visit is conducted in a language that you speak and the doctor doesn't speak, and we need an interpreter. And these are all things that we got set up for telemedicine and are available. The doctor should ensure that nobody else in their family is behind them listening to the call. So we are requested by the regulators to tell you who's in the room and to make sure that privacy is maintained. And it should be the same on your hand. If you want your significant others or family members to be present, bring them along. If you want to have part of the conversation private, try to make sure that the environment you're speaking from is private. And if you want parts of the visit to be private and part of the visits to be joined by other family members, make sure that they are aware that the visit is taking place and bring them along for the parts where they need to be involved. Often, but not necessarily, it is useful for the exam to have another person holding the device or helping with them, providing the provider a better view of you walking or of you standing up on your own. So maybe for that part of the visit, if possible, another family member can be present. It's not necessary though, and just like a regular visit, it should be your choice. Just like when you come to clinic, you need to decide whether you want someone else in the room or not. In the televisits, it should be the same. You should be the decision maker about who you want hear the conversation and who would you rather not hear the conversation. I was asked about other specialists and referrals that we often send people to. So I will divide the question to two. One is other doctors or other specialties, and the second part will be physical therapy and occupational therapy that I think need a special response. So I think that when we're asking about other specialties for telemedicine, I don't want to decide for the other providers what can be done by telemedicine and what not. I suggest contacting those offices. I think that doctors nationwide are aware of the hardship of COVID-19 and will do their best to help you out by telemedicine. There's lots of things that common people referrals we send to, like urology, psychiatry, gastroenterology. There's lots of things that they can offer by phone and lots of things that they can't. So for example, let's take the example of urology. Urologists can offer medication changes. They can ask you more questions about your symptoms so they can modify the drugs or the treatments. They cannot do procedures. So just like us, just like the DBS, I think the first thing to do is to request a telemedicine visit, see what best can be done in a telemedicine visit, and then decide together what are the next steps. The next steps may be trial and error with drugs or other interventions to see whether that suffices, or next step would be to decide that we'll have to wait for the time that the clinic's open. I can give you a personal example of a patient that I think needed neurosurgical evaluation. And we'll say, how can a neurosurgeon do something when they need to operate in a room and they need, of course, the in-person interaction? And it was actually the neurosurgeon that recommended, let's do a televisit. And after the televisit, he decided that in that specific case, really surgery is needed. So that person is in the list of the people that as soon as the hospital opens up would need to come in. And so televisits, even in specialties that are not intuitive to you, like surgery, may be extremely helpful. And I encourage you to contact the providers and see what is it they recommend. Televisits may be helpful with emergency rooms nearby. So for example, you need to see if that resource is available for for the people that may provide you care. I can give you an example. If someone fell at home and hurt their arm, they can talk to the local ER or local urgent care to see whether they can provide care like casting in an x-ray to avoid a hospital referral, which may be greater exposure to COVID than a urgent care facility where they can clean before you come, clean after you come, and the exposure to other people with COVID can be much better controlled than an active emergency room. So I would advise, with regards to every specialist and every instance, to try telemedicine first. Unless it's an emergency. If you think you have a stroke, if you think you have a heart attack, maybe these are instances where you don't want to wait and talk by telemedicine to a doctor. You can call 911 and get advice there. But with your more ongoing chronic consultations like urology, gastroenterology, even neurosurgery, as I showed, I would contact offices of doctors and providers and see what can be done by telemedicine. With regards to physical therapy and occupational therapy, I think telemedicine is a huge help. I would just I have to say that COVID puts me in a very odd position because my I always recommend to patients to go out of the house, walk as much as they can, see the world, be active. I try to convince people not to do home PT, but rather do physical therapy in the facility because they have more resources. And in my experience, the experience of people who get PT at home is much more limited. There's much less that can be done. It's not as good. So here comes COVID-19 and all my recommendations about exercise and activity and see the world and breathe fresh air and interact with people and socialize. They all have to be put on pause for a while. In that setting, people that can get home telemedicine PT, telemedicine OT, I've heard of rock steady sessions that are going by telemedicine. They're all great. They're all great, and we cannot compare them to PT, OT, or exercise in a facility because that's just not currently available. They need to be compared to the alternative, and the alternative is watching TV and eating. And compared to these two, telemedicine can be amazing. What our therapists at Columbia can do in telemedicine visits with my patients is outstanding. And I would encourage everyone to do it. And again, now use the COVID-19 pandemic. You don't need to live next to an excellent physical therapist provider. You can get them by telemedicine if they can provide it to you. So shop for telemedicine services, for PT, for OT, for exercise programs. The Parkinson's Foundation has a lot of resources on their websites. Our patients love it. This is time where you can get care from providers that in other instances you may have not be able to see because of spatial distances, because of insurability, like which state you live in and which state they provide. I would encourage people to use that for as much as you can. Home PT, home occupational therapy can be extremely helpful in additional ways than just trying to replace the regular PT and OT. For example, what they can do that regular PT and OT cannot do is assess the safety of your environment. They can see the hallways you walk in. They can see where you're practicing. They may tell you that the rug you have is beautiful, but just not appropriate because you may trip on it. They can advise you about where to put the food for the pet, but you won't stumble on it every time you go to the kitchen. So PT and OT, again, your provider care, may have actual advantages in telemedicine services, and I encourage you to I would start with contacting your own PT and OT and exercise programs that you participated in to see whether they transition to telemedicine. If they have, great, and use them. If they didn't, go to national resources and use the fact that you no longer are restricted to your own environment, that you can really go national to seek for PT and OT programs. Okay, I was asked a couple more questions. One of the question was, should I tell my doctor if I developed COVID symptoms or if I don't feel well? So I think that, of course, if you have medical symptoms and you have a primary care provider that is not your Parkinson's doctor, they should know first if the symptoms are related to breathing or to general medical symptoms. I can tell you from my own experience that I really would like my patients to let me know if they don't feel well, if they're concerned that they have COVID. And I think that in a couple of instances, I was able to be helpful. So I would encourage you that if you think that you've been affected by COVID, or if you think that you know you've been affected by COVID and you think it may have affected your Parkinson's symptoms, of course, contact your Parkinson's provider and do let them know. They may be resourceful in ways that you don't know. In a lot of places like New York, we've all been following up podcasts and information from our hospitals and from the centers where we provide care, so we can direct you to where to get care for COVID if that is really the issue. We also want to know what happens when people with Parkinson's develop COVID, and we won't know if you didn't tell us that that happened. There's also decisions that need to be made that the Parkinson's doctor can help you with. Like, for example, I would tell people to prepare medications if you go to the hospital, because if hospitals are overwhelmed, they may not have all the Parkinson's medications. So if you think you may be admitted to the hospital with COVID, it's not unwise to take your pills with you. Also, if you need to take them every 3 or 4 or 5 hours, and this is in the setting of emergency room, you may be able to take the medications that you brought with you and not wait for the ER to provide it for you. So there are some tips that your providers can provide you with. So I think that it's probably very wise to let your Parkinson's doctor know if you think that you have COVID or if you were diagnosed with COVID. Another question that I was asked is if I can describe what is covered by insurance and what is a copay for telemedicine visit and physical therapy visits and occupational therapy visits. Insurances are much more lax about telemedicine reimbursement now because of COVID-19. Everybody understands that keeping people at home is probably cheaper than any other option because people are healthier this way. There are so many insurances and so many different circumstances that I cannot describe them all, but the Parkinson's Foundation is going to place links to important websites and useful information about reimbursement for visits and for televisits that I encourage you to take a look at. Also, with regards to physical therapy, occupational therapy, and other online services and online classes, please look at the links that are going to be attached to this podcast. So I was asked about the day that COVID would be behind us. We're all looking forward to that day. And what will happen to telemedicine? I think that telemedicine was way underutilized before COVID-19. It has so many advantages that I can't imagine that the world will go back to where it was pre-COVID. The people that have used it and have benefited from it, I can't imagine them willing to go back to the situation where this is no longer available. So the question is a question that will depend a lot on the regulators and the insurance systems. Will we be able to provide telemedicine visit out of state after COVID-19 or not? In what instances? What would be the setting, or what would be the reimbursement? I think that telemedicine is extremely useful. In-person visits are, when possible, are better. The personal interaction is really, really good, but maybe it would make sense to see a person with Parkinson's twice a year or once a year and conduct 2 telemedicine visits in the interim. For my personal circumstances where I provide care in New York, a lot of my patients go to Florida in the winter, and if there would be a way to use telemedicine for this population when they're there, I think everybody would be extremely happy.